morning, ma'am, sir. I'm Michael Guevara from BSN 212E. So today I will perform the return demonstration for Leopolds Manuever. So to determine number of fetuses, to identify the presentation, position, degree of descent, and attitude of the fetus, to identify the point of maximum intensity of the fetal heart tone in relation to the woman's abdomen. So the material that will be needed is stethoscope, towel, alcohol, and pillow. So the procedure is to wash hands to deter the spread of microorganisms. So make sure to perform hand washing or hand hygiene. Now explain the procedure to the patient to gain patient's cooperation. So, good morning, ma'am. I am Michael Guevara, your student nurse for today. May I know your age, name, and birthday? So, ma'am, today I will examine your abdomen to determine the position and the heart tone of your baby. Now, provide patient's privacy to ensure patient's comfort. So, I have already closed the door, the window, and the curtain. Now let the patient empty her bladder before the procedure. A distended bladder may slightly deviate the uterus. So ma'am, may I ask if you have peed already? Okay. Position the patient on a supine with one pillow under her head, knees slightly flexed, and expose the abdomen to facilitate accurate assessment and providing comfort. Flex knees relieve the tension of abdominal musculature. I'm going to place pillow and flex. Now place rolled towel under patient's right hip to shift uterus away from large blood vessels and thus prevent supine hypotensive syndrome. Okay, ma'am, I will insert the towel under your hip. Is it okay for ma'am? If right-handed, stand at woman's right facing the patient to easily grasp the symphysis pubis to be done in the third maneuver. So I am right-handed, so I am facing the patient. So the first maneuver or fundal grip to determine whether fetal head or breech buttocks is in the fundus. Face the patient and palpate the uterus fundus to determine what part of the fetus lies in the upper part of the fundus. So ma'am, I will expose your abdomen. Is it okay? If it feels hard and round, freely movable and palatable, so that means that is the head. Breech feels softer and nodular. So for the second maneuver or umbilical grip determines position of the back. Palpate in a downward direction on the sides of the abdomen by applying gentle but deep pressure to determine the position of the fetal extremities, fetal back and anterior shoulder. Palpate with one hand steady and on the side, the other hand exploring the other side. If fetal back, a long continuous structure will be felt. If extremities, it will feel nodular, reflecting the portion of the fetal extremities. One hand steady and one hand is moving and exploring. Same goes on the other side. So for the third maneuver or Pollock's grip, determine the presenting parts and if engagement has occurred. Place one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and fingers to feel presenting part. The head of the inlet or pelvis in zero station in presenting part is still movable. It is not engaged. So now we will touch your lower abdomen or your pubis. Okay, so for the last or fourth maneuver, pelvic grip, turn and face the woman's feet to confirm the findings of the third maneuver, and determine deflection of the vertex into the pelvis. Move fingers of both hands gently down to the sides of the abdomen towards the pubis. Okay, so palpate for the cephalic prominence or vertex. Prominence on the same side as the small parts suggests that the head is flexed. Optimum prominence on the same side as the back suggests the head is extended. So I will please be patient and will slightly palpate going towards the pubis to confirm the position of the baby. Now locate again back the fetus and place the stethoscope over and listen to the fetal heart tone for 1 full minute. Normal fetal heart tone is 120 or 120 to 160 beats per minute. Going to palpate again. This is the back of the baby. Now note the location rate character of the fetal heart tone. In cephalic presentation, fetal heart tone can be heard either left or right lower quadrant abdomen. If breached, the fetal heart tone can be heard above the level of the umbilical, either left or right. Now make the patient comfortable to ease and promote relaxation. Now, I will put down your clothes back. Document the observation made of fetal prominent findings or fetal heart tone, presentation, position, attitude, and whether engaged or floating to promote database for future. So ma'am, the position of the baby is in vertex, the attitude is flex, and the fetal heart tone of your baby is normal, which is 130. So that's all. Thank you.